Hey guys, welcome back to another SMA Victor podcast. I am your host, Victor, aka Victor the Inspiration. In today's video, if you guys have been keeping up with my content these past 2 months, roughly 3 months, you will know that I created a video talking about how I was thinking and brainstorming about creating a reaction video to go over about the new SMA treatment breakthrough that is happening within the SMA community. And long story short, I was down and under the weather for several weeks, literally around Thanksgiving, and I couldn't be there and attend this webinar. So I came across the video recently, and I didn't know that they actually uploaded it on YouTube. So I brought up the video here so we can actually watch it live and go over it together. And just in case if you guys haven't seen it yet, I thought this would be a good idea to add and react to and have it here on the YouTube channel. But let's get right into it. And this is by Kier SMA, and the original video will also be linked within the description. So let's go into it. I know we made videos and podcast episodes talking about this medical treatment breakthrough, which is significant within the SMA community. But without any more talking, let's get right into the video. Let's get right into it. So I have no idea what to expect. Okay, it looks like he's getting some things set up.
Hello and welcome everybody that's just starting to join us here and logging in. We have a minute or two to get going, so we'll let other people join in, and then we are planning to start right at the top of the hour, so just another minute or two.
Okay, so let's fast forward so we're not waiting too long.
On this new treatment break, a lot of
Let me put up my volume as well.
Again, thank you everybody for joining us. We still are going to have another minute or so as people are logging on, but I actually might get started with a few housekeeping items. We actually have a lot of slides here, a lot of topics to get through. And so want to kind of get moving and get through all the information that we have here. So just housekeeping while still waiting for everybody to join us today on this joint webinar that we have where Novartis will be joining us, where we're touching on this new treatment breakthrough, Itvisma. But housekeeping, just to let everybody know, we are recording this webinar. I wanted to start off by just saying people shouldn't worry about noting all the details down, taking screenshots, or looking at links and things like that that we're going to show up on the screen here. It's a recorded webinar that we'll post later. And all of these slides, all of the resources are going to be available afterwards. So hopefully in some ways you can just kind of take in the information. It'll be available afterwards, and we'll push that information out. Definitely in some ways, look at this webinar as an introduction to this topic. There's a lot of details. We're not going to get through everything today. There's going to be a lot of follow-up with more information, more resources afterwards, many more opportunities to get information over the next couple of months and into next year as well. And if we actually go to the next slide, just to kick things off, lots of opportunities in person as well that are going to follow up from this one webinar opportunity. Couple of housekeeping items as well, that this is one of these items where there's definitely a lot of rules and regulations that govern what should be said and what can't be said in a group forum like this. So definitely regulations govern a lot of the topics that can be talked about. We got a lot of questions submitted to us. And so we are going to try and get to a lot of those questions in the slides that we're going to cover. We have a lot of questions at the end that we're going to actually read off and get answers from Novartis on as well that came into us. But we have no way to get through everything that came in. And again, we're going to follow up afterwards with a lot more information as well to try and answer the questions that came in. We had about 500 questions, a little bit over, that came in submitted to us. So an awful lot that we're going to try and cover. And again, today is really just an introduction, and hopefully everybody can look at it that way, and much more to come afterwards.
Really cool. This looks like a photo from a Kier SMA conference.
What I wanted to start off was just to highlight what this treatment breakthrough, what this regulatory approval means to this community as a whole. Just kind of stepping back, that we have this approval for Itvisma from the FDA. We're now going to move from this regulatory approval into the steps to get access to this treatment. What we have, though, is a really good result for our community. It's important to recognize that getting any approval in any disease is a big deal. Getting an approval for a treatment in a rare disease is even more difficult. But especially this year, a lot of you know this is a very difficult year for FDA approvals across the board. There's been delays, turn downs. So for us to get this approval this year in particular really stands out as a key accomplishment of this community's efforts. What we also got, and this is the thing that then on top of all that really stands out, we were able to get a broad label from the FDA, broad approval where the FDA gave the people that are going to be included in the label no restrictions in some ways from 2 years of age and up. And this is very important that we didn't just get an approval, which covered the criteria in the clinical trial that you're going to hear about from 2 to 18, but the FDA gave us approval beyond that for people 2 years and up, all ages, no restrictions. So we don't even have a restriction stopping at, say, 30 or 40 years of age. This goes all the way up. And that is something that is really important.
Yeah, I wanted to touch on that. I was curious to see if he was going to mention it. He might mention it in a few seconds or so. This is my first time watching it with you guys as well. But so the difference between this treatment, which is Invisma, and compared to Zolgensma. So Zolgensma is a medical treatment breakthrough that is being administered for SMA patients, but it is only accessible for those under the age of 2 years or younger. So it's pretty much infancy. And however, Invisma is very, very similar to Zolgensma, but this is actually able to treat older SMA individuals from children to young adults to teens and young adults, is what I meant to say. So, Invisma is just like Zolgensma, except Zolgensma is again only administered for infancy, those under the age of 2 years or older. 2 years or younger, compared to Invisma, which is this new medication right here, is actually able to be administered for anyone above the age of 2 years old, which is a huge breakthrough within the SMA community. So I wanted to mention that because I think that's important to highlight as well.
Important. It's something that we've all been working on for a long time in this community to make sure that people realize and appreciate we have unmet needs, and especially our older, symptomatic teens and adults, big part of our community, big unmet needs, very important for us to address. And this is an approval that we got from the FDA, which recognizes that need. And the approval they gave us, again, very broad, addressing it. So it's great to see that that message from all of us in the community is being listened to and addressed. What I also want to highlight is the role of everybody in the community here in getting an approval like this. We're saying thank you to Novartis and our clinicians for doing the really hard work of this clinical trial and all the regulatory work that goes into it. But also a thank you to the people that participated in the clinical trial. That's not an easy thing to do. It takes a lot of time and effort. And also with a lot of our clinical trials, that aspect of the placebo control, a difficult thing for anybody to do, to go into a clinical trial with placebo controls. But beyond that as well, this is something that I think really stands out for our community, makes this community so special, and is a key part of why we get these approvals. Doing clinical trials in the way that is very difficult with, again, placebo controls, real outcomes, but narrow criteria. It's something that's very difficult for a community to take on, where a lot of people are going to be told, no, you can't participate. But that's something which is critically important to give really good data from a clinical trial. And when you get that conclusive data, that's what can go to the FDA and then actually results in that broader label that then, in this case that we got, it covers everybody 2 years and up, even though it was not a narrow criteria. That's essential. It's something that is very difficult to do and takes the support of the whole community to allow that to happen. And that's what's given us this result here. So it's a thank you to everybody that participated. Thank you for the whole community that supported this design of clinical trial, and also did all of this advocacy that goes alongside. It's a lot that we've done with the FDA, with regulators, and we're doing it now with payers. Positive advocacy, your stories, your information, that goes along with getting an approval like this and is going to help us with access as well. And also the thank you to the community here for supporting the early research that led to this as well. 10, 15 years ago, the basic research that was taken on, that takes that amount of time to deliver us now with this treatment breakthrough. So we go to the next slide. I will say as well, we're going to hop through some of these slides pretty quickly, but this one's got a lot of detail to lay the foundation for what we're talking about here with this new treatment, Invisma. few critical things to now bear in mind and get information on. So this is a one-time treatment. It's a gene replacement therapy. So this is focused on that missing gene in SMA, SMN1, replacing that. It does it with this vector called AAV9 to get it into the body. It's a one-time. And in some ways, this is the aspect that's going to be important as we go through some of these slides. Looking at this as permanent. It stays in the body. We don't have a lot of data, when we're talking about 5, 10 years, 20 years out, what's really going to happen, but it's there in the body and it should be working for a long time. We don't know again, because it's a new development, a new technology here, but that's one way to kind of look at it, why we put it in quotes a little bit, but it's important to remember that one time and looked at as permanent.
Yeah. I don't know if he's going to say it here, but when we made a podcast episode talking about in-depths of Invisma, and specifically just Invisma, and we even created I even created another video, another podcast episode comparing the two, and you guys can look at the history of the podcast and check it out here. But what I wanted to mention is it's incredible because Invisma is a one-time infusion, just like Zolgensma, but the difference between and the huge thing about Zolgensma and Invisma is, again, Zolgensma is only for infancy, only those under the age of 2 years old that have SMA, and Invisma, it's a little bit of a tongue twister for me. Invisma is for 2 years and up, which is pretty incredible and amazing. But it's a huge breakthrough because when I was doing the extensive research, creating a podcast episode for you guys, a lot of people were showing significant improvements and significant breakthroughs in terms of being able to pick up the arms and being able to sit up and being able to do a lot of these improvements and developments that they weren't able to do prior to receiving Invisma. So, which is huge. But yeah, I just wanted to mention that really quick.
What we're also making sure people understand is now we have gene replacement therapy across all ages in SMA. We have Zolgensma, which goes from 0 to 2, and that's the intravenous delivery of this same AAV9 gene therapy, but intravenously delivered. Now we got Invisma, which is the same treatment, but now delivered intrathecally. And this now goes from 2 years of age and up. And again, here just reinforcing any age, but there's also no restrictions about type or SMN2 copy number either, a broad label. But we have these two approaches to gene replacement therapy now. Reminder again on Zolgensma that's available. It's for that younger group, 0 to 2. It's delivered intravenously throughout the whole body, but there's limitations then on the size of body that somebody can have that, where you're putting so much into the body intravenously that there's limits with how the body reacts and responds to that, which means that's why we have that cutoff of 2 years of age. It's about really size and how much you can really put in to a body. You need a different route to now deliver gene therapy to anybody that's older and bigger, and that's the intrathecal approach. And this is something that, again, we've been working on for a long time. We knew this 10, 15 years ago. You need two different approaches here, intravenous and intrathecal, to be able to deliver gene therapy to everybody across the whole spectrum of SMA. Both approaches, though, are focused, replacing the missing gene, but ultimately trying to increase that SMN protein. One throughout the whole body, but critically the most important part, both do, but here intrathecally to the spinal cord into the motor neurons. What we're also going to talk about a little bit here today is expectations of what's going to happen after approval with timing, when access is going to be available. There's definitely some aspects that are well set up now with manufacturing.
I don't know if he's going to say it because I know he mentioned he's going to kind of speed go through this, but I wanted to mention too is the reason how these types of medications are able to make such improvements and advancements for SMA patients as they are being administered these SMA medical treatment breakthroughs, medications, is because it boosts their SMN production. So, for example, what I mean by that is SMA, for those of you who are new here or are a little bit vague or don't know too much about the in-depths of SMA, is, in simple terminology, in an analogy I like to come up with and share with you guys, is SMN production, when you have SMA, it's kind of like, I picture like a Wi-Fi modem. Picture like a digital device and a Wi-Fi modem. The closer you are to the Wi-Fi modem, what happens? The signals from your device to the Wi-Fi modem, your uploads are going to be quick and much more responsive, right? Much more reactive compared to when you pull away and walk further away from your Wi-Fi modem. What happens? Things start to slow down and you get less reactions, right, from your uploads. So where I'm going at this, and the reason how I came up with this analogy, and the reason why I talk about this analogy, is because SMN production is just like that. So SMA is progressive. So by it being progressive, over time, your muscles slowly start to atrophy as, again, time goes on over time, right? So time in this context is you slowly pulling away and walking away from the Wi-Fi modem. Now, what these medications do is it helps us draw back to turn back around and become much closer to the Wi-Fi modem to then reproduce and re-strengthen that connection to give us the signal we need to say, hey, this signal is here and let's work on it so we can get that production and these signals going back and forth so we can, experience these developments and breakthroughs, to say the very least. It's an analogy I came up with, and I know it's a little bit unique and different, but it's by far the best analogy I personally can come up with as an individual who has SMA type 2 and who has been taking Spinraza for several years.
Having the treatment available. Novartis will talk a little bit more about that. We're also in a pretty good position with the healthcare providers and the treatment sites that we've got available, that we've built up over the last 7-8 years. There'll be a little bit of training and getting processes in place, but that really shouldn't be a bottleneck here on access and getting things available. What we are going to have to do a lot more work on is the payer coverage side. And this is definitely something which can take a while. It can sometimes take 6 months to a year sometimes to get formal policies in place. Things can happen before that, but they're usually done as kind of one-off, case by case. Takes a little bit more effort. So it won't stop things right up front, but it is going to take a while. And this is going to be probably the key area that we've got to focus on for a long time. A lot more advocacy and a lot more work to make sure that we get coverage, and that the key thing that you'll hear, the coverage matches up to the FDA label and doesn't have restrictions. We go to the next slide. Again, focusing here, I'll go through quickly, but this has been a key area of focus for us. It's great to see this result, focusing on our older community, adults. We've had a lot of adults coming back into our community, joining us over the last few years. We need to pay attention and make sure that we're addressing needs, the unmet needs, and getting treatments like this approved that are going to be accessible. If we go to the next slide, a little bit of a reminder again here from it taking time to roll out access to treatments. This is what we've done going all the way back to 2017 with first approvals. It takes a while for these treatments to roll out. Initially, again, it was with maybe kind of the treatment sites that we had to work on, getting a number of those available, enough available, but then it does take work with payers as well. And so it can take a while. Overall, you can see we're at about 80% now of everybody in the US with SMA getting access to at least one treatment. So again, there is still a little bit more work to do, but the main message of this side is, again, it does take a while. This isn't overnight. The key focus that we are going to have is with payers to make sure that we get access over time. We go to the next slide.
In case you guys missed it, so roughly 80%, 77%, according to this graph, who have SMA are receiving some form of an SMA treatment, whether it's Spinraza, which is the first medical treatment SMA breakthrough within the SMA community, again, which is Spinraza, or also known as Neuricin. That's a bit of a tongue twister for me too. The next one is Evrysdi. It's Evrysdi. Evrysdi is a oral medication, that is being administered for, and also another medical treatment breakthrough. The third one is Zolgensma, which is, the one we mentioned earlier today. And the fourth one, which is new, is, I think Novartis is a fourth one. And there's currently other medical treatment breakthroughs within the SMA community that are still in development. And again, there's episodes within the podcast you guys can check out if you guys are really interested in that. but it's Spinraza, which is the first medical treatment breakthrough that happened in December 2016, and the following one is Evrysdi, and then the third one is Zolgensma. And then, of course, over the years, we've just been making much more medical treatment breakthroughs within this past decade. So it's pretty extraordinary. But where I'm going with this is 77% of SMA individuals who have SMA are receiving some form of SMA treatment, which is huge. To go from no medical treatment to no medical treatment to now having something available is extraordinary and a miracle. In my opinion.
The key aspects on this advocacy that we're going to do with payers, but also here pointing out why we were successful once again with the FDA and regulators, the positive patient advocacy that this community has always taken on. All of you, I think, get involved in this, sharing data, but also your voice, your stories, the impact that SMA has on your daily life, but then the impact that a treatment can have on your unmet needs. And we've done a lot of that over the last couple of years, sharing that with regulators, which I think had an absolute big impact on getting this approval. And we'll be doing it with payers as well. One of the key things that we've always done, and is I think going to be really important here with access, is this angle of making sure people understand it's one SMA, one community, but one SMA where when you have a treatment like this, a genetic treatment that works in one group, everybody has that same treatment potential. The genetics are the same for everybody with SMA. Everybody's missing that same SMN1 gene. This treatment is going to work for everybody. We have to do trials in a rare disease in a narrow group and get positive data. That doesn't mean that that treatment is not going to work in others. It's the way that you have to do the trials. And the way SMA is set up means that those treatments are going to work in all these other ages. And that's why the FDA gave us that approval. The FDA knows that and believes in that as well. If we go to the next slide.
That's awesome.
I believe Jackie is going to come on and talk a little bit more about what we've done to get to this point.
Great. Thanks, Kenneth. Yeah, so one of the key...
Really quick, as you see me like slowly glancing up here, it's just because I'm making sure that everything's been recorded. I have another screen in front of me, so I'm making sure that what you guys are seeing is also what it is I'm seeing. I want to make sure there's no hiccups on that end. So if I'm going like this, it's because I'm looking at the screen to make sure everything is still going.
One of our key goals in communicating with FDA is to communicate unmet needs in the patient voice, and that's kind of getting back to that positive patient advocacy that Kenneth was just mentioning. And so you can see here some of the recently completed outreach to the FDA. We share things like our State of SMA report that many of you have probably seen that details demographics and needs within the community. We've shared items like our benefit risk survey, highlighting that people with SMA are still willing to endure pretty significant risk for additional treatment benefit. And then we, in addition to providing data, always try to provide patient quotes and patient voice to really give context to the data that we share with FDA, really helping them understand, as Kenneth was saying, the needs in SMA. And I think this recent approval is kind of testament to some of the voice that you have lended and we have shared with FDA. Next slide. So now I want to cover just a few of the resources that we have, as we know that this webinar is only an hour, and so we won't be able to get to everything and everyone's question, but we wanted to share some resources that you can look into if you have further questions following the webinar. One of them is that we have a dedicated web page for Avisma. There you can find all kinds of information about it, and we're constantly updating that as we get more information as well. Next slide. Other resources to highlight are two recent publications that came out. I know a lot of you had questions about the clinical trials. These two publications talk about the clinical trials that were conducted. And so they will be linked in the slides post-webinar as well if you wish to check those out. Next slide. We also have created a gene therapy video. This video discusses more kind of about the mechanism of action or how gene therapy works in the body. And it covers both the Zolgensma approach or an IV or intravenous approach and the Atisma approach of intrathecal delivery. And so if you have questions kind of about how gene therapy works, this would be a great video to explore. Next question or next slide. I'm going to hand it back over to Kenneth now, and he's going to talk a little bit more about coverage for gene therapy.
And the efforts that we're going to have with payers to make sure that we have access and this is covered. One of our, here kind of the key goals that we have, we're looking for individuals to have the choice. That's really important, that there shouldn't be any restrictions put on to your individual choice about which treatment you want to go on from insurers or coverage. It should be between you and your healthcare provider to make that decision, and all of the options be on the table for you with no restrictions from coverage. If we go to the next slide, going pretty quickly here, but
don't quote me on this. I made a video talking about it, so forgive me if I'm not too accurate with this, but I know Cure SMA has advocacy groups, or Cure SMA advocates for you if your insurance happens to deny you from trying to access some form of a SMA medical treatment. I also want to say that MDA, which is Muscular Dystrophy Association organization, is also has advocacy for you as well to help you get your foot into the door and get your help you get medical treatment for your SMA. So I know there's advocacy groups and advocacy people that really try to help you in case your insurance happens to deny you, and there's individuals like that, and you can find these resources by going to Cure SMA. I know Cure SMA does it by Cure SMA's website, and again I will link the original video within the description of this video, and also I believe MDA has it too, does it too. I haven't been too familiar with MDA for a few years now, but I would love to get back into it, but I haven't been too familiar with MDA, but Cure SMA I know really do help you. And also Biogen. Biogen is another advocacy that can help you as well.
Reinforcing again some of the things Jackie was saying, we did this with payers as well, sharing your voice, your data, reinforcing that we have unmet needs. We've been doing that for the last couple of years.
And by sharing your voice and your data as well is I actually have a YouTube channel called Victortheinspiration, which is my primary personal brand that I created several years ago. And where I'm going with this is I actually have an entire YouTube playlist dedicated to my life with SMA type 2. So I talk about from the first time I talk about and been documenting my Spinraza injections, how I felt prior to receiving Spinraza to how I have been feeling after I started taking and receiving Spinraza. And I have been documenting this entire journey for several years now. So I wanted to talk about that too. I think it's important to, one, spread awareness, but two, share the benefits of receiving Spinraza. Now, of course, every individual is different. I cannot speak for everyone who has SMA. I can only speak on my own behalf. But every individual who has SMA, again, we have our own unique set of challenges and obstacles that we face on a day-to-day. But, I just wanted to share this with you to show you guys, the documentation is available with my life with SMA. Again, documenting the process by taking Spinraza. So you guys can check that out as well by, again, going to my YouTube channel, Victortheinspiration. And, you can also go to the history of this YouTube channel's podcast. And I also talk about my story as well throughout the episodes.
And now we're going to get involved in what we call a treatment-specific outreach to payers. And we do this every time. We're actually conducting this right now to reach out to all the payer contacts that we built up over the last 6-7 years and reinforce what I was just saying, the message on the previous slide. But if we go to the next one, you'll see this is what we're sending out actually to all of these groups here. Again, we've probably got about 200 contacts that we reach out to now and we keep up to date. And then we reach out with this treatment-specific advocacy. If we go to the next slide, we'll just show you what we're putting out now, and you will have access to this advocacy.
Let's go back
if we go to the next slide, we'll just show.
So it says treatment-specific FDA approved, educate payers, public and private insurers about the clinical and real-world evidence and important patient needs met by the treatment. advocate for full coverage without delay and as indicated by the FDA label. And then it says national insurers and payers, and then it has the insurers as well. You guys can see it all here.
Show you what we're putting out now, and you will have access to this letter again. This will be on the website. But our initial outreach to payers following approval is a little bit of education, what the treatment is, but really kind of putting a line in the sand saying our expectations are that the payers will cover this treatment for anybody that is included in the label. And here again, we've got a broad label, no restrictions, 2 and up. And so we're saying we are looking for that from payers. We do not want to see any restrictions or delays for anybody that's covered in that label. We put that out right away. We will follow up, though. What we've seen in the past in the model, if we go to the next slide, is we'll have to do more. This outreach will just kind of, again, put a line in the sand what our expectations are. But this is what happens generally, and it's what's happened to us in SMA, that we have a narrow trial. This is what we conducted in the 2 to 18-year-old group. We hope for, in this case, we've got broad label from the FDA, which goes from 2 and up, no restrictions. Payers will, in some ways, always try to then go back down to a narrower group of coverage, often sometimes just trying to stick to the trial criteria. Sometimes they'll meet in the middle. For us, that isn't anyway good enough. We've got a label from the FDA that includes everybody. There's a logic and there's a reason why that was given and why this treatment is going to work with everybody that's got the same genetic makeup. The treatment is going to work in the same way. And we do a lot of advocacy there if we do see restrictions. They might be case by case again in the first, say, 6 months while policies get in place. But when policies come out, and what you're seeing here is what we did with Zolgensma, where green at that time was a specific policy which was okay, covered. But reds and things like that were where a payer had decided to not include somebody that was in the label, and we would push back. And probably quite a few of you might get involved in this, not just individual, which I'll say something on, but at the local level, state by state, we will get involved and push back, and you can get involved, sign on letters if this happens, and testimony and things like that as well. But it can take some work, it can take some time, but we have been successful in the past. What I'll also say is on a kind of a more individual, probably case by case, we often see this even now, that there can be denials up front when you first go for coverage. We are always saying, do not get discouraged. Appeal. Often a lot of those appeals, and even in some ways, the majority of those appeals do get approved. It's kind of a standard process for those denials to come through first, but appealing is so important. And us pushing back, we'll be supporting you. We'll be supporting at the local level. And again, our advocacy, if we see any of these restrictions that come in that do not match the label that we got approved. If we go to the next slide.
That's awesome. So if you guys are having some pushback or uncertainty or rejections, from receiving medical treatments, Cure SMA will help you within the process. Now, of course, there's no guarantees, but, they really do try their best to advocate for you, and they are very well experienced with this entire process.
He's going to come on and just say a little bit about this area.
Thank you, Kenneth. As part of our ongoing efforts to support treatment access and coverage, again, Cure SMA sponsors the collection of real-world data via the Adult and Pediatric Clinical Research Network, or APNCR. This network of established clinical research experts conducts clinical trials and also works to capture clinician-entered data to help us better understand the impact of treatments in real-world clinical settings. This year, we worked to expand the network to bring on some additional sites with an adult focus, and the data captured will be published to not only support ongoing advocacy with payers, but also be leveraged to develop some resources that can support shared treatment decision-making amongst both community members and providers as well. Next slide, please. Now, in addition, we are also working to identify and partner with providers and SMA treatment sites to support maintenance of the Cure SMA Find a Treatment Center tool. This online directory features US-based treatment sites and allows users to find centers within local communities. The results can be filtered by age, treatment of interest to align with your needs and preferences. We currently have 255 centers that are onboarded. However, we recognize there may be a need for more. So as a means to update the resource over the past year, we've been reaching out to centers across the country, encouraging them to opt in or review their listings. And with the recent approval, an additional IDVISMA treatment filter will be included within the tool. So we will be re-engaging all of these centers as a means to verify availability of the treatment within clinical settings in the coming weeks and months ahead. Next slide, please. And also, we wanted to highlight our health insurance roadmap. Again, we recognize that insurance denials are common, but the majority of individuals who appeal are ultimately successful. So we wanted to revise this resource to include some additional practical guidance and resources that can be leveraged by both providers as well as community members to navigate the appeals process. This resource is currently available both on our Care Series booklets page as well as our insurance resources page. We do consider it a living document, and within the next week or so, we will be updating it to also feature the Novartis patient access support program specific to IDVISMA. So more to come here as well. And with that, Kenneth, I will hand it back to you to cover the next slide.
And this is the final slide before Novartis comes on. And so I will say this is where things get a little more complicated. And certainly here, we're probably just touching on these topics. These are going to be key areas for you to look to have conversations with your healthcare provider on. We're talking about options and the choices that you've got to make. And so a few key principles and some important thoughts in this area. Again, what we look at here is it's individual patient choice, working with your HCP. We don't want any restrictions from insurers to come in to restrict you to one option or one particular pathway. It should be up to you, and everything from payers should be on the table. We're definitely getting to the situation now with more options, and in particular, more pathways for people with the treatments that are available. So we do want to highlight, we're at this point now where there certainly isn't one best, one right way for everybody in the community. It's going to vary. Your particular medical situation, but also your personal choices, your situation in life, what your goals are in life, are going to have an impact on what the best option and what the best pathway is for you. So what we're looking at, and we wanted to highlight this, and probably here again, much more to come, bearing in mind the SMN-dependent approaches, which again, they work in slightly different ways, delivered in different ways, but they ultimately are all focused on increasing the SMN protein. Those are SMN-dependent approaches, the treatments that we have available now. There's also going to be independent approaches, treatments that focus on different parts of the body that are impacted in different ways by SMA. So when we're looking at choices between treatments, pathways where you're looking to switch or combine, the framework that we put out is it's important to think what makes sense just on paper. Is there a logical reason for one treatment over another, or in, again, combining or switching? Looking also then, not just on paper, but is there data that would allow you to have some more information on that choice, that particular pathway? The final decision that is going to come in then is, will insurance cover it? And that isn't going to be yes in all cases here. So what makes sense? Does it have data to support it? Are you even going to be able to do it with insurance coverage? We will say this, that there's very limited data head to head to compare our current treatments on efficacy, on benefits. It's just not there. Our field is moving so quickly. We're getting approvals of the individual treatments, but there's not a lot of data to be able to kind of compare them head to head. They do have very different delivery approaches. You're going to hear very specifically now the details of the delivery for IDVISMA. That's one thing that's out there, is something that you'll definitely want to kind of factor into your decisions in the pathways, how these SMN-dependent approaches are actually delivered into the body. The main goal that we have when we're talking about combination, taking a treatment and another treatment at the same time, concurrently, combining treatments together. This is what makes sense. The real goal there is to take treatments that work in different ways, that have different mechanisms. It isn't the really main goal for combination approaches to take two treatments that work in the same way. There may be some benefits, but it's not the main goal there. And so hopefully this makes sense, but the main goal there could be looked at as you want to take an SMN-dependent treatment and then take an SMN-independent one on top at the same time, concurrent. A treatment that works on the SMN protein and a treatment that might work on the muscles. That's the real goal of combination. Here,
So in case you guys missed it, is what he's saying is in case you have a question, I made a video talking about this, which is why I am more aware and knowledgeable with it. And you guys, again, can look at the history of this YouTube channel's podcast. But the question is, can you combine SMA treatments? For example, Spinraza and Novartis. Can you combine the two? And the answer is yes. You can combine, say, Spinraza and Novartis or Advisma. Or can you combine Evrysdi and Novartis? And the answer, again, is yes. That's pretty much what he's saying here, in case you guys overlooked it or didn't quite catch it.
Things that we wanted to point out, it is going to be restricted to go from Zolgensma to Advisma. That's going to be restricted in the label and even the sense part of it. They're the same treatment approaches, just delivered in different ways. There's issues once you've had this treatment with the antibodies and what could happen later if you try to repeat, even with a different kind of delivery mechanism. So that's going to be looked at as restricted in a pathway. Mm-hmm. Going from one SMN upregulator that's focused on the backup gene or something like that, delivered in different ways, switching between those, switching to the new option here as well. That's looked at this switch approach where you're stopping one treatment to go on another. We think that can make sense. That should be an option for people. Insurance should cover that. The data's not, robust there. There's not a lot of data behind it, but it makes sense on paper and it should be a choice that is not restricted by insurance. That's up to you and your HCP to kind of figure out. What we're looking at here, and this is the most complicated one, it gets into a bit of a gray area. What happens here with the aspect of Advisma being permanent? It's staying in your body. It could be working in your body for a very long time. So what happens with the choice of, going from one of the treatments now onto Advisma and then potentially back on? Is that going to be looked at as that next choice is a switch? Or is it much more looked at as, no, you've got this gene therapy in your body permanently, so now it's looked at more as a combination? It's a bit of a gray area, and this is one that we're going to have to focus on, see if it makes sense. But, is there data and will insurers cover it? That's one that's going to be probably difficult. We'll say that. The insurance coverage of that when it gets into this combination approach of treatments that work in the same way is going to be difficult. Jackie, is there anything else you wanted to add on this one? Again, much more to come.
Yeah. And I don't know if he's going to touch on it right now, but I want to quickly just mention it as well. Is the reason why he's saying it's going to be difficult for insurance companies to say accept both forms of treatments is because, again, Novartis which is also Advisma, is literally around $2 million. So by taking one form of medical treatment, that costs, say, like Spinraza, for example, which is 6 figures per dose, and you receive it 3 times a year. And you want to also take Novartis, which again is also known as Advisma, it's going to be a little bit harder for insurance companies to accept both because, one, it's so new still, but 2, it's the price that is quite significant. So it makes it a little bit more challenging to have both options accessible for per SMA individual, if they chose or tried to heed that path.
I think on this topic.
No, I would just echo that and say yes, lots more to come. We're still collecting a lot of data to help inform treatment decisions, as Kenneth was saying, with switching, with combinations of SMN upregulators, and those sorts of things, more to come.
Great, thank you. And so here, Carol, I'll switch over to you. We'll keep going. We've got a lot more slides. We're about halfway through. Carol from Novartis, if you want to take this from here.
All right, thank you. So thanks for including us. So we are thrilled to join your call today to discuss more detailed information about it.
I actually know this guy. Oh, that's cool. I never knew that. That's
Advisma,
really cool.
Also known as onasemnogene apaparvovec, BRVE. And today we'll spend some time talking through gene replacement therapy, how it works as a one-time dose, the safety and efficacy of Advisma, and we'll review our Novartis support services and then answer some questions. Next slide, please. So my name is Carol Welch, and my colleague is Leslie Milliner, and she'll be joining shortly to present. And we're the patient and community liaisons, and we're the newest addition to the Novartis SMA team. Our role was created to connect with and support the SMA community at live events. So we do attend the Summit of Strengths, the Walk and Roll, and the annual SMA conference. And we've met a lot of you already and look forward to seeing others at our future events. So our primary responsibilities include engaging with people who have SMA, their caregivers, and the local community advocacy partners. Educating the community about SMA, gene therapy, replacement, and our treatment offerings, and also building relationships with local advocacy chapter leads to identify ways we can further support educational needs. Next slide, please. So Novartis is very committed to neuroscience, and our ambition is to create a transformational impact for people living with severe neurological conditions and their caregivers by discovering, developing, and delivering innovative medicines that change the course of disease progression. And this is aligned with Novartis's culture and mission to create this transformational impact in neuroscience. Next slide. So we are excited that Evisma has been approved by the FDA in the United States, and Evisma is the only one-time gene replacement therapy for children 2 years of age and older, also teenagers and adults with spinal muscular atrophy. Next slide. So working with the community and our advisory board members, we created our campaign, Picture Your One Dose Life. And this campaign is meant to help us imagine what a one-dose treatment would mean. While Evisma is a one-time dose, it's important to remember that lab testing and the corticosteroids are required. Next slide. So let's review the indication and the important safety information. So what is Evisma? It is a prescription gene therapy used to treat adults and children 2 years of age and older with spinal muscular atrophy. Evisma is given as a one-time intrathecal injection. Most important safety information you should know about Evisma: it may increase liver enzyme levels and cause hepatotoxicity. So patients will receive an oral corticosteroid medication before and after Evisma injection and will undergo regular blood testing to monitor their liver function. So please contact the doctor immediately if the patient's skin or whites of their eyes become yellowish, if the patient misses a dose of the corticosteroid or vomits it up, or if the patient experiences a decrease in alertness. Some other things to watch before and after injection with Evisma: infections may lead to more serious complications, so you should follow an infection prevention procedure and contact the patient's doctor if the patient experiences any signs of an infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Decreased platelet counts may occur following injection with Evisma. Contact the patient's doctor if the patient has any unexpected bleeding or bruising. Peripheral sensory neuropathy has occurred with Evisma, and patients and caregivers should contact their doctor right away if the patient experiences numbness, tingling, prickling, or pain in the arms, hands, legs, or feet. Decreased blood platelet or red blood cell counts, sudden kidney change, or increased bruising or bleeding may happen and be signs of thrombotic microangiopathy or TMA. So if the patient experiences any unexpected bruising or bleeding, seizures, or decreased urine output, contact their doctor. There is a theoretical risk of tumor development with gene therapies, so please contact the doctor or Novartis Gene Therapies if a tumor develops. Next page, please. So looking at the vaccinations and Evisma, we do want to encourage you to have a conversation with the patient's doctor because due to taking the corticosteroid, the vaccination schedule may need to be adjusted. We recommend protection against influenza and RSV, and that the vaccination status be up to date prior to receiving IDVISMA administration. Some important information about contraception and egg or sperm donation with IDVISMA. Children of childbearing potential should use an effective method of contraception and refrain from egg donation for 6 months following IDVISMA injection. Men capable of fathering a child should use a barrier method of contraception and refrain from sperm donation for 3 months following IDVISMA injection. The most common side effects that occurred in patients treated with IDVISMA were upper respiratory tract infection, fever, upper gastrointestinal symptoms, increased liver enzymes, headache, dizziness, pain in the extremity, low platelet counts, and sensory disturbances. So this is not a complete list. We do encourage you to have a conversation with the doctor, and please contact the FDA or Novartis Gene Therapies to report any suspected side effects. Next page, please. So gene replacement therapy for patients 2 years of age and older. So this is IDVISMA. It delivers a functioning copy of the SMN1 gene to produce the SMN protein. And this essentially stops the progression of SMA. So IDVISMA is for patients 2 years of age and older. So that includes children over 2, teenagers, and adults. It is a single dose intrathecal injection, and we do require the pre-medication with the corticosteroids. Next slide, please.
And I think the steroid is because of inflammation, or maybe to prevent risk of infection as well.
This next section, we'll spend some time discussing IDVISMA and gene replacement therapy and how it works. Next slide. So IDVISMA is designed to work continuously in the body, and it targets the genetic root cause of SMA by delivering a new working SMN1 gene to replace the function of the missing or non-working SMN1 gene to produce the SMN protein. So looking on the left side of the screen at the delivery vehicle, the new working SMN1 gene is placed inside this delivery vehicle, and we call it the vector. So the vector is then injected into the body, into the intrathecal space, and this vector delivers the new working gene to motor neuron cells, enabling continuous production of the SMN protein. IDVISMA works continuously to stop the progression of SMA by delivering this new working gene. It can stop the progressive loss of motor neurons, which is essential to muscle function. And as Jackie mentioned earlier, there is a great video on curesma.org showing how gene replacement therapy works. Just search video in the search bar and it'll come right up with a link for you to watch the video. Next slide, please. So now we'll spend a little time talking and reviewing about how IDVISMA is administered and what is involved. Next slide. So IDVISMA is given as a one-time injection into the intrathecal space, which is the area surrounding the spinal cord filled with the cerebrospinal fluid, or CSF. Pre and post procedure will take additional time, and the injection itself takes about 2 minutes to fully administer. Sedation or imaging techniques may be needed for some patients and will be determined by their treating doctor. Lab testing and the administration of oral corticosteroids is required before and after injection. So now I'm going to turn it over to my colleague, Leslie, and she'll complete the rest of our presentation.
Hi, everyone. Like Carol said, my name is Leslie Milliner, and I am the other patient community liaison for Novartis, and I am thrilled to be here today. We're going to jump right in on what are some of the potential benefits and risks for ITVISMA. So we can head on to the next slide. So what we looked at were 2 clinical trials. And in these 2 clinical trials, the main clinical study was called STEER. The purpose of STEER's study was to establish the efficacy and safety of ITVISMA in people who had never been on an SMA treatment. And then we had a supporting study called STRENGTH. The purpose of STRENGTH study was to evaluate the safety and efficacy of ITVISMA in people who had been previously treated on Spinraza or Evrysdi. So in these clinical trials, we used 2 different assessments that were specifically made for SMA patients. We have the Hammersmith Functional Motor Scale Expanded and the Revised Upper Limb Module. In the Hammersmith Functional Motor Scale Expanded, it assesses 33 activities, including sitting, standing, and climbing stairs. Each activity is graded from 0 up to 2, 0 being unable to perform, or to 1 being less than able to perform, and 2 being able to perform the action. You have a total possible score of 66, and a higher score means there's greater motor function. On the HFMSE scale, a 1 to 2 point increase is considered a positive change, and an improvement of greater or equal to 3 is considered a clinically meaningful change. So when we looked at the revised upper limb module, this assessed 19 activities that involved hands and arms. And you could do activities such as picking up things, placing them down, or pressing buttons. And 18 out of 19 of those activities are graded from 0 to 2. Once again, unable to perform, less than able, and be able to perform that action. One of the activities is scored on a scale of 0 to 1. You either can perform it or not. And the total range of the score is from 0 to 37. And similar to the other assessment, a greater score means greater motor function. So the main objective of the STEER study was to establish safety and efficacy. And we looked at individuals 2 years and to 18 who had never been on an SMA treatment. So we had a total of 126 participants in the study. 75 of the participants were given ITVISMA, and 51 of them were part of the sham control group. That means that no active drug was injected.
Essentially, that's the placebo.
All 125 participants were able to sit, but never able to walk independently prior to the clinical trial. You can go on to the next slide. So here on this graph, it showed that a single dose was shown to significantly improve motor function at the end of the 1-year study as measured by the HFMSE in people who had never been on an SMA treatment. And you can see that there was a 1.88 point difference at that 1 year. So in looking at that, in people who had never been on an SMA treatment, you had people that saw a 2.39 point improvement in their motor function score as measured by the HFMSE. And this is versus a 0.51 point improvement in that sham control group. Now, a secondary result of the STEER, and we cannot make conclusions from the following data. They are presented for observational purposes. These endpoints did not meet the statistical significance as outlined in the study, but people treated with ITVISMA also saw a 2.44 point increase in their RULM score, a scale that I mentioned earlier that was used for strength and motor function with their hands and arms. And that's versus the 0.92 point change in that sham control group. So the supporting study, known as the STRENGTH study, was an open label study with no competitor group. And this means that in the study, all participants received ITVISMA, and participants and doctors both knew that a treatment was being given. The result of this study could be influenced by the expectations of patients and doctors. But the purpose of this study was to establish the safety and efficacy of ITVISMA. But in this one, we looked at patients 2 to 18 years and old who had previously been treated with an SMA therapy. So who participated in the study? Well, we had a total of 27 participants who were able to sit, but were not able to walk independently prior to the clinical trial. And those efficacy points were secondary endpoints that were measured using both that Hammersmith Functional Motor Scale Expanded and the Revised Upper Limb Module. So if you look here at these two graphs, on the left-hand side, we have a change in the motor function from the beginning to the end of the study for the HFMSE scores. And so if you look at the x-axis at the bottom, you can see that it was up to 52 weeks. And if you look at the y-axis on the left-hand side, it's the average change from the baseline in that HFMSE score. And that 0 that has that little dotted lines, that's their baseline going across. And so you can see that that's plotted across there. And then if you look at the right-hand side, we also have a change in the hand and arm function from the beginning to the end of the study. So we have our baseline going up to 52 weeks on our x-axis and the same averages. Well, what we noted was that as a secondary endpoint on these graphs, the average change on the HFMSE score, or on the graph on the left side, was 0.17 at 1 year. And on the graph on the right, or the RULM score, it had an average change from baseline of 0.29 at 1 year for patients treated with Itvisma. So the safety profile of Itvisma was studied in people in new treatment and in people who stopped the previous treatment. So that was a total of 153 patients from ages 2 up to 18 across those clinical trials. And so the safety profile showed that the most frequently experienced adverse reaction was in the main study group was upper respiratory tract infection, fever, stomach-related symptoms, elevated liver enzymes, headache, dizziness, limb pain, low blood count, and sensory disturbance. When safety was evaluated in people who changed to Itvisma from either Spinraza or Evrysdi, no additional safety events were found compared to that main study. Other side effects are possible. This is not an all-inclusive list, and for more information on the safety profile, you want to make sure you're reaching out to your doctor. So I'd also like to talk to you about Novartis's patient support. We offer ongoing support here for our patients and family members throughout their journey with Itvisma. So Novartis Patient Support is committed to providing support for patients, caregivers, and their care team throughout their treatment. And one of the things that they offer are one-on-one support calls. So we have what's called an Itvisma start form. And once that's completed and signed, you are enrolled in that Novartis Patient Support and connected with a Novartis Patient Support case coordinator. And they're going to be your main point of contact, your dedicated point of contact the whole way through. And so let's talk about what those case coordinators can do. They can provide insurance support, financial information support, and ongoing support for eligible patients that are prescribed Itvisma. The goal of the Novartis Patient Support is to help patients with SMA and caregivers feel supported and informed from day one. So we've covered a lot of material, and so like Kenneth was saying, there's going to be a lot of opportunities to go back and review this information, but we're just going to do a quick summary of everything before we go on to our questions. So stop SMA progression with Itvisma. Consider a single dose, the only one-time gene replacement therapy for kids 2 years.
It says scan here to see the study results, which is why I moved my camera.
Age and older, teens and adults with spinal muscular atrophy. Meaningful efficacy that was shown in the STEER clinical study. A risk-benefit profile in 153 patients from 2 up to 18 years of age, and patients with SMA who were previously treated with Evrysdi and Spinraza did not identify any additional safety events with Itvisma administered as compared to the STEER study. Now you can see here they have a QR code. If you'd like to go back and look at some additional information on the graphs or some of that data, you can go here and it'll take you to itvisma.com. But we encourage you to ask your doctor about stopping SMA progression with Itvisma. So Kenneth, I'm going to hand it right back over to you.
Great, thank you. And we got about 10 minutes. I think we're going to try and get through as many questions that we got lined up here. We selected, I think, about 15 that were submitted, and we'll try and read these off. We might not make it all the way through, but we're going to go as quickly as we can to get through these items. And so starting off, one question that came in, and again, we were trying to pick out themes that a lot of people were asking, but one example, is it approved for all ages? Is there an age limit or upper age limit?
Okay, I'll start with that one. So Itvisma is approved for children 2 years of age and older, also teenagers and adults who have a confirmed mutation on the SMN1 gene, and there is no upper age limit.
Right, and we'll keep going through quickly. So another one, can patients with scoliosis receive it? Is it possible with fused backs or rods?
Itvisma is delivered via lumbar puncture in the spine. So you want to ask your doctor about eligibility for Itvisma, and then it would be determined on a case-by-case basis.
Yeah, I want to mention something too from personal experience, because I take Spinraza, which is very similar because it is a lumbar puncture as well. So for me, is I have severe scoliosis, and because of my severe scoliosis, it makes it challenging for them to access the spot they need to administer the Spinraza medication. And again, I know this topic is more about Novartis and Itvisma, but the reason why I am bringing up this conversation is because your doctor will be able to determine whether or not I don't want you to have scoliosis and think, oh, I'm not going to be able to receive the medication. Your doctor can work wonders and be creative. Of course, keeping your safety at the forefront and the main priority, right? But I don't want you to feel like because you have severe scoliosis that makes it impossible. Because at the end of the day, anything is possible. And where I am going with this is I have severe scoliosis, which makes it much more challenging and difficult for me to receive my Spinraza, which is through a lumbar puncture. But my doctor was able to find a way where there almost wasn't one. So I just wanted to bring that up really quick.
Next question asking, is there a projected timeline for commercial availability?
So we project availability for Itvisma this month.
Next question, very broad, and certainly some things covered, but there's some key items to kind of highlight here again. How do we get this treatment?
Yeah, that's a great question. The doctor's going to schedule lab tests to help determine eligibility for treatment, and it's generally best to have those tests done as soon as you can. And so you'll work with your doctor to get those scheduled, and then while you're waiting for the results of the last test, you want to ask the doctor to submit that Novartis patient start form that I was mentioning earlier, so that you or your loved one can get enrolled in the patient support services. And then once you're enrolled, your team will work with you to support you through that journey with Itvisma. Now, the next step after that will be to get insurance approval, and the doctor's office will complete and submit prior authorization and fulfill any appeal requirements.
Next question. I don't know if there's something else to say, but specifically asking there, how will this be covered by insurance?
So your doctor's office will complete and submit a prior authorization and fulfill any appeal requirements. Novartis Patient Support may help you find programs that provide additional financial resources to help support you and your family. The case coordinator will share information on available financial assistance based on your specific situation.
Another question that came in asking, if you get Itvisma, do you still need Spinraza or Evrysdi?
Well, you should talk to your doctor about all of your loved one's current medications as well as your treatment history. And then that way you and your doctor can determine, the right treatment approach for you.
Another similar question, but very specific here, asking, and a few things came in, is this the same medicine as Zolgensma? Somebody asking, I'm curious how this will be different from Zolgensma? And same theme, if Zolgensma was taken earlier on, can someone take this new Advisma later?
That's a great question.
Wow, these are some awesome questions. So Zolgensma is a prescription gene therapy replacement for treatment of SMA in children under 2 years of age. It's administered through an intravenous catheter using the syringe pump, in which the medication is given slowly over about 60 minutes. Whereas Advisma is a prescription gene replacement therapy for the treatment of children over 2 years of age, but also teens and adults. And it's given as a one-time injection into the spine, which takes about 2 minutes to fully administer. But the injection procedure does take a little bit longer. And then a person can only receive Zolgensma or Advisma. So Novartis has not studied the efficacy or safety of Advisma in patients who have already received Zolgensma.
Next question asking, is there a weight restriction?
Kenneth, no, there is no weight restriction. The indication is for anyone with SMA over the age of 2, and the intrathecal formulation was developed to address the needs of an older population, and it allows for fixed dosing that is delivered directly to the cerebral spinal fluid, irrespective of a patient's body weight.
And the next one asking about a different criteria, but asking, is this available for all SMA types? Is it for SMA type 1? Is it for SMA type 3?
So yes, yes, and yes. Advisma is indicated for the treatment of SMA in adults and pediatric patients 2 years of age and older with confirmed mutation of that SMN1 gene.
That was another great question.
How is the drug administered?
Yeah, let's go through it. So Advisma is given as a one-time injection into the intrathecal space of the spine. Sedation and imaging may be needed for some people, and that's going to be determined by the treating doctor. People who have received Advisma need to start a daily oral corticosteroid a day before the injection and continue for at least 2 months after the injection as directed by your doctor. Your doctor will confirm any future doses of corticosteroids that you or your loved one might need to take, and then they'll also schedule, follow-up appointments or any lab work that they might need.
Stay tuned, because I'm actually going to create a video as to why the steroid is recommended. I'm very, very curious. I didn't hear about that when I was doing the research during my podcast episode talking about this. So stay tuned for future episodes. Probably realistically, the next episode after this one is going to be talking about why is the steroid recommended. I'm genuinely curious. I don't know if it's because of inflammation or infection to be premeditated. I don't know.
Clarifying a little bit here, asking, is this a one-time treatment? Is it once a year or ongoing?
So once.
So Advisma is given as a one-time injection into the intrathecal space. So it's just the one time.
It's one and done.
How is monitoring handled?
That's a really important question. So for the first 2 months or maybe even longer, the doctor is going to monitor liver function with weekly blood tests and clinical exams. So after that time when you or your loved one stops the corticosteroid treatment, that's the treatment period and the taper period, the doctor will continue to monitor your liver function every other week for another month. And the doctor will also run weekly blood tests to keep an eye on your platelet counts.
So for clarification, for the first month, it's once a week, checking your, doing some lab work. And then after the first month, which will then be the second month, will be every other week, which would say be twice for the second month.
I think we've got about 5 minutes here. I think we might be able to get through everything, but we'll try and go pretty quickly. So asking here about possible side effects.
Yes, so the most common adverse reactions in our patients treated with Advisma were upper respiratory tract infections, fever, upper gastrointestinal symptoms, increased liver enzymes, headache, dizziness, pain in the extremity, low platelet counts, and sensory disturbance.
This next question asking, what are the antibody titers levels requirements with Evisma?
Titers, what's that?
Well, a person with SMA will need antibody titer testing before receiving Evisma. You want to work with your HCP to determine the antibody level cutoff that is appropriate. So, please connect with either you or your loved one, connect with your HCP and discuss that in detail.
Asking, how does this treatment differ from the rest that are currently available?
The safety and efficacy of Evisma and other SMA treatments, it can't be compared because at this point we don't have head-to-head studies that have been conducted. Evisma is the only one-time gene replacement therapy for kids 2 years and older, including teens and adults with spinal muscular atrophy. And other SMA treatments require repeated and ongoing dosing. Evisma is a single one-time dose that is designed to work continuously, and lab tests and administration of oral corticosteroids are required before and after an injection.
Last question I think we got lined up asking, can we see clinical trial results?
It's another great question.
So yes, so we did review the clinical trial results during the presentation, but you'd like to continue and learn more about it, you can find the information on our website, itvisma.com, which is itvisma.com. And you can also see the frequently asked questions on the website under the resource tab.
And just a few final slides, I think, wrapping things up.
Yeah, so on behalf of Novartis, we want to thank Cure SMA for this opportunity and for the SMA community. You guys are the heart that drives our work. Now, if you do have additional questions, like I said, we covered a lot. We've got lots of resources for you, but we want you to make sure that you are connecting with your healthcare team, talking to your doctor. We have information listed here to reach out, and just as Carol mentioned, we also have itvisma.com for you to review any information that you need. Thank you.
Thank you. And just the last few slides, and if we keep going just through to the end, I think, again, just reiterating, we'll be sending a lot of this information out. There's going to be a lot more that's available over time as well on various websites. We'll make sure that the emails are sent out. Even things like we were just talking about there, the publications for the clinical trial results. I think you were saying it's on your website. We've got it ours as well. So it's going to be available, and we'll make sure we push out that information, those links as well. But I'll wrap up as well just with the final slide here saying thank you. Thank you, Leslie, Carol. Thank you to Novartis for joining us on the webinar, but what you did as well.
This was a very, very good video. I hope you guys enjoyed today's video, and shout out to the Cure SMA host that hosted this webinar. You guys were phenomenal, and it was a very educational and informative video. I recently came across this, and I knew they were coming out with a webinar. I signed up for it as soon as it got released, which was, I think, like two weeks before before it became public, which was December 11th, which is when it was recorded live. And I meant to, my intention was to do a live reaction and watch the webinar together with you guys, but then I had fallen quite ill and under the weather with my respiratory, where I literally was down for several weeks. So I couldn't do it no matter how much I tried. So I recently came across this video. I didn't know that they actually uploaded the webinar on their Cure SMA page. So I thought it would be a good idea to make a YouTube video and do a reaction video and watch it together with you guys. So this is literally the first time I'm seeing it with you guys. So, but yeah, I hope you guys enjoyed today's video. If you guys did, please like the video, comment down below what you personally learned and gained value from this video, and subscribe if you guys are new. And really quick too is I actually recently just became a published author. And again, I have SMA type 2, and I recently became a published author. My book is talking about my journey with living with SMA type 2, talking about the mental and physical challenges that come with living with a progressive disability. I talk about depression, anxiety. I talk about surgeries. When I underwent my back surgery experiences, I literally had dozens upon dozens of back surgeries. just within my back alone. I'm not even exaggerating there. And I even talk about ammonia and collapsed lungs and being in the hospital and ICU experiences and visits and all these different things that happened within my life. And I not only just documented my journey, but I even was sharing what it was I was doing to help me through and navigate through these different seasons and processes within my life. So it's by far my greatest and most vulnerable project yet. It is currently available online at Barnes & Noble's and Amazon's website. And here's a QR code in case you guys are watching this on your screen or tablet. You guys can scan the QR code or simply go to Barnes & Noble's and Amazon's website, and you can type in the book title, Become the Victor, Turning Trials into Triumph, or you can simply just search up Victor the Inspiration within the search tab, and my book will come up. And also the links will be within the description as well. But if any of you guys are from Cure SMA or any organization, and you guys would be interested in having me speak at your guys' events or do some form of a collaboration through a Zoom interview, for example, I am open to anything and any and all opportunities that you guys can help assist with or be part or would love to have me be part of. I'm open to anything and everything. I love you guys. I appreciate you guys. Again, I hope you guys enjoyed today's video. Please forgive me if throughout the episode my neck was doing this. My neck is getting tired. And forgive me, earlier I had to kind of drive my wheelchair back a little bit and kind of stretch for a quick second. But yeah, I hope you guys enjoyed today's video. Again, I love you guys. I appreciate you guys. And as always, remember, grow through what you go through. And again, the original video will also be linked within the description. Much love.